Hi, Dr. Alfred Marquez, Marquez Integrative Dental here in El Paso with an update on all the coronavirus excitement that's going on here in El Paso. Today, April the 16th, is day one of your automatic extension for your income tax. Yay! But realistically, all kidding aside, we're up to 393 cases, confirmed cases, here in El Paso. There's probably a lot more cases because a lot of them haven't been reported. Unfortunately, we've had 6 deaths here in El Paso. So, you know, we're still being really cautious with the coronavirus. I will discuss a little bit about what we're doing here in the office to make it safe for our patients and also for the staff, all of us. We all need to be safe during these uncertain times. Supposedly, we're going to be open April the 22nd is what the governor set forth about a month ago, where we will be able to see patients. Up to this time, we're able to see emergencies and urgencies. We've been a little bit slow in taking off with that because of the proper equipment that we have to get. I'll go over some of that here in just a little bit. But what I'd like to share with you, what can you do to continue to be safe? And I'm afraid that as the rules become more lax, people are going to think, hey, we're over it. And you're going to see a spike, I think, in cases. I hope I'm wrong, but we just have to be cognizant of that. What can we do to be proactively involved in preventing ourselves and our loved ones from becoming ill? So the first thing I'm going to touch on are the pillars of health. There's 3 pillars, maybe 4, we'll talk about them. One is nutrition. Nutrition, it's absolutely imperative that you eat good foods that are going to give you good, healthy nutrition. The number one thing that really probably affects us a lot are processed foods, primarily because they've got a lot of sugar. We as dentists have always said, avoid sugar to prevent tooth decay, but there's a bigger reason. There are definitely health implications. So, for example, this is a cake that was brought to me. I'm gonna throw it away. I'm just kidding. Everything within moderation is okay. So, nutrition, you gotta watch your nutrition. Eat correctly, cut sugar, lots of fluids, lots of water. When I say fluids, that doesn't mean sodas or processed juices. It means water. Exercise is a second pillar of health. Go outside, take a walk. Now, I realize that we're limited as far as what we can do to exercise, to go out to a park and to walk around. That probably is going to change, but you can go outside and walk around your house. You can go outside, walk around the block. Just keep your distance from other people, which is important. We'll talk a little bit about that. Get sunlight. Sunlight is great for you. You create vitamin D, and D is important to our immune system. Sleep. That's our third pillar of health. You need to get adequate, good sleep, consistent sleep. That is so very critical. One of the things that we do, and you should try to do, to get the most ideal sleep is, for example, if you drink coffee, have it in the morning, but don't have any in the afternoon if you can so avoid it. Make yourself go to bed at the regular time, night after night. That way you develop these rhythms that are going to help you get more restful sleep. This is important for your children as well. You'll find that you'll start waking up without an alarm clock as you set those circadian rhythms, and that's where you get the most restful sleep. Sleep is critical to your immune system, to your mind, your brain, reestablishing just so many systems in our body. What you might consider doing, what a lot of people do is they watch television or they're on their phone and then they try to go to sleep. But there's a lot of blue light being emitted by those devices, and blue light inhibits your production of primarily melatonin, which affects your sleep rhythm. So one of the things you can do is get yourself some of these glasses. These are blue light filtering glasses, and if you find that you're compelled to use your telephone or device before you go to sleep or watch television, you wear these glasses, and that helps filter out those harmful rays of light. Not really harmful, but rays of light that impede your production of the melatonin. You can pick those up on Amazon. They're really not expensive, and it'll really help you. There's some devices that have blue light filters. I don't know how effective they are, but you might explore that as well. Getting back to nutrition, I said go out and get sun. Your vitamin D levels, if you're like most everyone, your vitamin D levels are low, you might consider supplementing. You can consider supplementing with vitamin C. It's been shown to really help your immune system combat viruses. So let's talk a little bit about social distancing. We've spoken about that before. I'm sure you've heard a lot about it. But the idea is to stay away from people, stay away from those potential people that can infect you. Or maybe you've been exposed to the virus, you don't want to transmit it to the other people. It's really interesting the way this virus works. You can be infected and you can be shedding the virus, in other words, sharing the virus, for up to 2 weeks before you really show symptoms. You can then develop the disease, then you get over it, but yet there might be up to, I think I saw 14 days where you still continuously shed virus. And that can affect people and those around you. So that's why social distancing is so important. You want to be 6 feet away from anyone that's adjacent to you. If you go out in public, wear a mask. Get yourself, just make a sheet. You can get on YouTube and see how to make mask, and it's so easy, and wear those because at least some kind of protection is beneficial. Don't get complacent. Keep wearing masks. I went out today and I noticed a lot of people without masks. Yesterday it seemed like everyone had them, but I think that's a reflection of some of the attitude or complacency that we're seeing. We're thinking, okay, it's getting better. We're not going to need as much. So this is almost like playing Russian roulette. The more you go out there, the more likely that you'll be exposed to the virus. So keep that to a minimum. I'm going to show you the proper way of using a mask. And this is another thing I see is an observation. First of all, wash your hands, wash your hands. Take your time washing your hands. Rule of thumb, 2 happy birthdays is approximately 20 seconds. You wash your hands, wash your hands. Don't forget your thumbs. A lot of people forget their thumbs. They just go like this. No, washing is a top the bottom, the thumbs, just everything. And then drying your hands. Then put a mask on. Why do you want to put your mask on? Your hands have got to be clean because you're going to be touching this. If your hands are contaminated, you're going to mess up the mask. So now you put the mask on, stretch it over, cover the face, get it to adapt over your face, or if you use a handkerchief or a rag or whatever, just make sure it's as adapted to your face as possible. And so you want to make sure it's on and comfortable. This is probably one of the hardest things to do. Your mask is on, do not touch your face. A lot of us, when we have a mask on, we do this. We do this, or we have an itch and we do this. Don't touch your face, because then you could introduce the virus that is causing the infection. This is another thing that I see, people wearing a mask like this. And I'm going, what the heck? What is that supposed to do? You got to cover the airway. Breathing in, breathing out. You'll get used to the mask wearing, and it's for your benefit. So those are just some tips. I will keep everyone posted as far as what's going to happen here in the practice, but we are available for emergencies. Please call us. If we don't answer, listen to the message. You'll find out how you can get in touch with us so that we can be in touch with you and keep you comfortable. Again, be safe. Did I mention wash your hands? Wash your hands again and again and again. That is a primary source of viral transference, is your hands. So wash your hands. Be safe, take care of yourself, take care of your family, and realize that once again, today is different than yesterday because we're one day closer to the end of this fiasco. Thank you.